Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Prerequisites of prerequisites for myomectomy. For doing myomectomy, anemia should be corrected. We should arrange for blood. We should get consent for hysterectomy also. Husband's semen analysis should be done. Timing of myomectomy is important. Timing of myomectomy is in the immediate postmenopausal phase. Anesthesia which is given for myomectomy is hypotensive anesthesia. Vasopressive injections should be given in the myometrium. We should tie a tourniquet or a clamp to the uterine artery, and the clamp or tourniquet is released every 45 minutes. If
thank you and thank you for watching.